Questions about hypersensitivity reaction infrequently come up in final exams. They're quite common to be asked about, particularly in postgraduate examinations as well, but these should be known about, particular type 1, which is anaphylaxis. So let's go through them. In type 1, the pathology that is being described is anaphylaxis, which is IgE mediated mast cell degranulation that leads to histamine production that then leads to edema, tachycardia, rash, shock and urticaria. It's probably the most dangerous one, acutely dangerous one, and the things you need to know, it's IgE mediated. And a good example of drugs that can cause anaphylaxis are the beta-lactams, which are penicillin, etc., cephalosporins. Type 2 hypersensitivity reactions are humorally mediated, which means there is antibody synthesis against the drug that you're giving. The sequelae of this can be hemolytic anemia, such as in the case of methyl-dopa. Other drugs can have antibodies synthesized against them, such as monoclonal antibodies, and a good example of that is infliximab. And essentially what happens if that happens is the infliximab doesn't work anymore. There is a loss of effect of the drug. Type 3 is an antibody-antigen complex forming problem, and what that means essentially is there is a complex formed in response to the drug that's been given, and therefore it can essentially disseminate throughout the body. And because those complexes are large, they can clump together and reduce capillary blood flow in certain areas. And what this can actually cause, oddly, is finger ischemia or digital ischemia, and it gives you a lupus-like reaction. An example of this is hydralazine, which is a drug used to reduce blood pressure. Type 4 hypersensitivity reaction is a delayed hypersensitivity reaction, and it is from memory. It is from your cells having memory of certain responses, so it's cell-mediated memory response, and this is the case of contact dermatitis. Certain creams, certain ointments such as nickel weird earrings with bad metals in it can cause contact dermatitis, various things, but it is a delayed hypersensitivity reaction. The last one to mention is type 5, which is an autoimmune condition. So basically autoimmune conditions can lead to complex formation, which gives essentially target organ damage. The important thing to realise about type 5 is that it is the one that is not induced by drugs. This is an autoimmune problem. So what do you do if you suspect a drug reaction or an adverse drug reaction or an interaction, etc.? The one thing you do is you tell the patient. Second thing is you document it. That's in the allergy section and in the medical notes. The third thing you can do is do a yellow card, and you can see that at back of BNF. You can also discuss the problem, if it's severe enough, after discussing with seniors, with the Medicine Healthcare Products Regulatory Agency, which is actually abbreviated to the MRHA, but it stands for Medicine and Healthcare Products Regulatory Agency. So these are things that you can talk about in your exam, and that actually hosts the yellow card system.